Ambassador Gupta, and also my colleagues for initiating this, and everybody else who has really joined today. I think we have to give a big applaud to this initiative. And it comes really at a wonderful time when Canada is leading in Canada this big replenishment, the fifth replenishment, and the Global Fund is really a key player in fighting against HIV/AIDS, malaria, of course, in addition to many others partners. And so it couldn't have been a better lead than Ambassador Gupta here and Prime Minister Trudeau in Canada. So thank you so much for initiating this. Just to share a few things, I want to also applaud Lois for her remark, and as well as her activism. The Global Fund, the other development partners, the government, civil society organization, youths, and we need to reach to zero, and we need to end it for good. That's what we really need to move forward. The UN/AIDS has set a target. We are all committed. The Sustainable Development Goal, it states it all. We say by 2030 we want to go to zero, and it's really crucial. I think if we work together through this strong partnership, I'm sure we'll achieve that. And we achieved there. And the voice we heard from young Lois and many others are really fundamental in terms of learning and doing better in many fronts. In the UN system, we are very much committed to work together. The UNDP has been the principal recipient of the Global Fund program, supporting the whole procurement and various supply chain element. Over the year, I must say, the cost of each of these medical support was at the beginning about $15,000 per year per person. Now you know how much it has reached to, $100 around that figure. I think this is a big achievement of science, research, and good effort of all the key players. I hope it goes further down and makes it much more accessible to everybody, even without government support, etc. In broader sense, its own initiative of tax levy to reach to a sustainable self-home owned initiative. Sadly, we are not there because the economy and other challenges. Therefore, the support from Global Fund is really fundamental, as well as from others. As somebody said just before, Global Fund over the years has contributed to close to $1 billion on HIV/AIDS, malaria, and TB. That's a very large amount of money, but we can also be proud that money has been worth invested. The HIV rate has gone down to half. That's a big life saving. It's behind all that story of the number. We have children who haven't lost their parents. There are life saved. Civil servants still working. Unlike so much loss in human resources and development efforts. So this is a big gain. I believe with continued support and a strong partnership from everybody, I'm sure we will end one day for good the HIV and AIDS. So let's all join together continuously and work with all the partners, bring science and research, learn from the youths. One challenging element which worries, and that's where I guess we need to really work forward, towards, is prevention. I hear these statistics about 65, 70,000 new infections every year. That's very sad. I think we have to really cut down there. I know we put emphasis on treatment, that is fundamental, but if we don't stop new infections, we will always have a tragedy of increased HIV, etc. And also, I read the statistics concerning, problem related to urban versus rural, educating, bringing awareness, communication is really fundamental, and we continue to work on that. In fact, we have been discussing within the UN system how best we can put our knowledge and our expertise to support, and we would be coming up with some ideas in the coming months towards that. The UNDP especially has looked into building some of the element of capacity within the Ministry of Health, supporting in terms of better management, in building its own capacity. We look forward to working with civil societies, communities, and all partners. And I want to really thank you everyone for joining in working together in addressing this, and we are committed within the UN system. Thank you very much.
For these and other stories, visit our website www.263chat.com. Follow us on Twitter @263chat and like our Facebook page 263chat.